Welcome to Vital Signs, where we are here to talk all things peak human performance and, above all, your greatest asset, your health. We believe that when we take care of that, everything else follows. You're in for a treat today because we have a great guest who's going to talk to us about the silent threat, all things heart disease and heart health, so that we can take control of that greatest asset. I would like to welcome to the studio Dr. Yassir Sonbol. He owns a cardiology practice that specializes in both general and interventional cardiology. Welcome to the show.
Thank you for having me.
So, heart disease is the leading cause of death. However, many people don't take any action until it's too late. Why do you think that is, and what can we start to do to change that?
Well, I think that's a very interesting subject, right? Most people don't want to admit that they're sick, right? Who wants to go see the doctor? I personally don't, even though I am a doctor. But I think the problem is we tend to downplay symptoms, right? And so people may say things like, I couldn't walk as far as I used to, but it's probably because I'm getting a little older, or maybe I'm out of shape, or maybe I'm overweight. When in actually that could be a sign of heart disease and they're just not aware of it. And so I think part of the key is really just getting regular primary care checkups, being honest with your physician about any symptoms you may be having. All those things are important to screen you for heart disease, especially if you have risk factors such as diabetes, cholesterol, high blood pressure. All those are risk factors for heart disease, and heart disease can sometimes be silent and only present, at an emergency. So that those are a lot of reasons for it.
So, talk to me a little bit more about the early warning signs that maybe we could be looking out for, because a lot of times, as you expressed, we don't really pay attention. We
Mhm.
might have vascular disease, and we don't pay attention to the fact that our feet are swollen at the end of the day because we're like, well, I walked all day every day. So, what are some of those early warning signs with regards to heart disease that we could be paying more attention to?
Sure. So I really like to kind of make the analogy here. So my analogy has always been your heart is kind of like your house. It's got architecture, plumbing, and electricity, okay? And all those things together work together to keep your heart pumping and keep you alive. And so there are definitely signs and symptoms for each one of those factors, whether it's the architecture, whether it's the plumbing, or whether it's the electricity, that you may experience that warrants different investigation. So let's just kind of break it down. So let's just say you have an architecture problem. Well, an architecture problem can mean that your heart doesn't pump as well, and or some of your heart valves, which we have four of them, aren't working as well. So those valves can either not open, or they can be really leaky. Or if your heart muscle, for example, doesn't pump as well, it means it puts into perspective that your heart can't push things forward, which is what it's required to do. So your heart is really a pump, and your whole vascular system is really a forward one directional flowing system. So if things can't move forward, they move backwards. And when they move backwards, that's what causes trouble. And so if you ever heard of people having heart failure, that's a syndrome, right? In which people retain fluid in their body because their heart is not pumping well, whether it's due to low heart function or whether it's in a normal heart function setting. So that's an architecture problem. Versus people who have heart attacks. That's what I would consider to be a plumbing issue, right? So we have arteries that go to your heart that feed the blood flow into your heart. And in those arteries, if you develop a blockage, now sometimes it could be a chronic blockage, so something over time that's developed, or it could be what we call an acute blockage. So, how I try to make the analogy to people when I explain it is, imagine your kitchen sink, it has a pipe in it. Sometimes the pipe gets over time, it gets blocked, and you pour Drano down the sink, and the sink unclogs and things go well. Other times, you could take something and shove it right down your sink, and all of a sudden, immediately the sink is clogged. And so that's the difference between chronic blockages and an acute blockage. An acute blockage is really a medical emergency, and those are kind of the bells and whistles in which we bring people immediately for intervention or try to open up their artery because it's a life saving event. So a lot of those symptoms people may have are things like chest pain, chest discomfort, pressure in the chest, a lot of shortness of breath may be a symptom, a lot of these symptoms occur with exertion. So they may realize, I'm walking up a flight of stairs and I get to the top of the stairs and I have to rest for several minutes because I got to catch my breath, or I'm having this pressure in my chest that goes away after 5 to 10 minutes of resting. So that's what we call angina. And so that angina is what is a sign of heart disease. Shortness of breath can be a sign of heart disease. So those are kind of, so then we've talked about architecture and plumbing. So let's talk a little about electricity. So electricity could be, people that have a weird heart rhythm. So atrial fibrillation, which is a very common abnormal heart rhythm that we see, and probably the most common abnormal heart rhythm. Some people feel it and some people don't, but in a lot of people, their heart may be beating really fast and they feel like their heart's beating out of their chest because it's beating so fast. So in all of those scenarios, those are symptoms that would require you to seek medical attention and most likely see a cardiologist to try to assess whether or not there's anything further that needs to be done.
Oh, I really like the analogy, the house analogy, because it gives us some clarity. And I'm going to ask you the next question because we have a lot of viewers who maybe are a little younger in years, and they're like, "Well, I'm young, I'm healthy," but more and more we hear about younger people, athletes, teenagers who have sudden cardiac death. What could we be looking for if we're younger and we're in relatively good shape?
So, in younger people, obviously, right. I mean, we all think we're invincible when we're young. And the reality is, in young people, most of the things that affect young people are usually there's something they're born with. So when you talk about athletes that collapse, for example, they have what we call hypertrophic cardiomyopathy, which is basically a genetic thing that causes their heart muscle to be abnormal and it predisposes them to these bad heart rhythms. There's several other types of scenarios like that, such as, arrhythmogenic right ventricular dysplasia, long QT syndrome. These are all electrical problems with the heart that are caused by a structural problem of the heart. And so it's hard to be able to screen that in young people, other than to say if people were having symptoms such as they're short of breath or they're having lightheadedness or dizziness or feeling like these abnormal palpitations in their chest, or they've had a passing out episode that they can't explain why. Even a family history. So if you have a family history of people in your family collapsing or dying suddenly for no reason, that could definitely be a genetic problem, which can cross into other, members of the family. And so in that situation, screening would be appropriate. Again, another reason to visit your cardiologist or visit your physician and have them evaluate this. But there's not always a sign or symptom that people get when they're young. A lot of times it just happens, and that's what we see in some of these athletes that die. And that's why athletes are screened for a lot of things, at least with an EKG. That's why all our kids, when they play high school sports, have to have some sort of physical to clear them for this because it's really hard to predict in younger people.
I think it's gotten a lot more media coverage of late, especially in the South. I mean, we're in Houston, and it seems like with the heat and and dehydration and everything adds up, it always ends up in the news. So thank you for shedding some light. And so I just want to tell everybody who's watching, this is sage advice. If you have a family history, if you've got any symptomology, it's time to get to a doctor, get screened, take some steps because early prevention is always, or early detection is always better than waiting until we have a life saving event. So, as we think about that, what is one habit that everybody watching today can adopt that could improve their heart health?
One habit for sure is obviously exercise, right? I mean, you can't underestimate the effect of exercise just on a physical, mental, emotional level and what it causes for people. So, exercise creates endorphins in our body that make us happy and make us feel relaxed and make us, despite the exertional work that exercise you're doing, it's just kind of this endorphin that's released from your body that actually, causes happipiness and causes a feeling of relaxation. So, exercise doesn't have to be difficult. I mean, I could tell you personally, I've been off and on, strategies of exercise for years. And even something as simple as walking is actually underestimated and how much benefit it can provide for people. So, on a personal journey, I actually went walking one time for almost 270 days in a row because of COVID. and I would just walk every single day, and I lost like 40 pounds doing that. I never felt better. It's a great exercise. So exercise of some sort, uh, whether how simple it is, can definitely benefit people moving forward. The other thing is obviously diet, right? I mean, it's important to watch what you eat. I always tell my patients, I don't ever tell people to eat like a rabbit because I don't think that's sustainable. So when people come to my office and they've had a heart attack and they're like, well, what should I eat? And I'm like, well, you just have to eat everything within reason, meaning you have to be, a middle ground. So if you're eating a lot of junk food, obviously it's probably important to cut that out and, um, eat things that are appropriate for you. But if you tell people just to eat salad and vegetables and fruits all day, well, that gets boring. So I always tell patients everything in moderation is probably appropriate. The one thing you can never do is you can never out exercise a bad diet. So if you're ever on a weight loss journey or whatever, there's no way, no matter how much you exercise, if you don't watch what you eat and diet, it's definitely not going to help you.
Absolutely. Thank you so much for that sage advice. And I just want to remind our viewers that none of this is medical advice. It's for education only. And it's always important to check with your practitioner before you make changes to your habits. But I couldn't agree more. Exercise and nutrition are key. So we really appreciated having you and this. If people would like to reach out and learn more, how can they reach out to you?
They can either, we have a website, it's sugarlandcardiologyspecialist.com. We are on social media like Facebook, Yassir Sonbol or Dr. Yassir Sonbol. We have our phone number here is 281-912-3866. They can call and make an appointment and come see me. Um, Lots of ways to get to us.
Fantastic. Thank you so much for your expertise. We do have to take a brief break, but if you're watching and you have any kind of symptoms, it's a good idea to reach out today. You have the tools here. And I encourage you to always make sure that you're taking care of your health. We will be right back after these messages.